Recovering from surgery can temporarily change the way you move, walk, and carry out daily activities. Whether the procedure involved your knees, hips, spine, feet, or another part of the body, healing often requires reduced physical strain and limited movement. During this recovery period, even short walks across large parking lots can cause pain, fatigue, or setbacks in the healing process. In situations like these, a temporary handicap parking permit can provide valuable support. A temporary disability permit is designed specifically for short-term medical conditions that significantly limit mobility. After surgery, it is common for patients to experience swelling, weakness, restricted range of motion, or difficulty bearing weight. Doctors may recommend minimizing walking distances to protect the surgical site and promote proper healing. Accessible parking spaces help make that possible by reducing the physical demands of everyday travel. The first step in obtaining a temporary permit after surgery is understanding eligibility. States generally require that the medical condition substantially limit the ability to walk. This might include difficulty walking a certain distance without rest, reliance on crutches, walkers, or braces, or instructions from a physician to restrict physical activity. Simply having surgery is not enough. The key factor is how the procedure affects mobility during recovery. Medical certification is required as part of the application process. A licensed healthcare provider must confirm that your post-surgical condition meets the state's criteria. The provider will typically indicate how long the mobility limitation is expected to last. This time frame helps determine the duration of the temporary permit, which may range from several weeks to several months depending on state regulations. The application process usually involves completing a state-specific form. The patient fills out the personal information section, and the healthcare provider completes the medical certification portion. Once the form is completed, it is submitted to the appropriate motor vehicle agency or local office. Some states allow submission by mail or online, while others may require in-person processing. After approval, the temporary permit must be properly displayed when parking in designated accessible spaces. Clear visibility is important to comply with enforcement rules. It is also important to remember that the permit is issued to the individual, not to a specific vehicle. It may only be used when the recovering individual is present in the vehicle. Accessible parking spaces are strategically located near building entrances. They are also wider than standard parking spots and include access aisles for safer vehicle transfers. For someone recovering from surgery, the extra room can make a significant difference. It allows careful movement when entering or exiting the vehicle, reducing the risk of falls or strain on the healing area. Using a temporary permit responsibly is essential. It should only be used for the duration of the qualifying condition. Once mobility improves and the permit expires, it should not be displayed or used. Misuse can result in fines, penalties, or revocation of parking privileges. A temporary disability permit is not simply a convenience. It is a protective measure that supports recovery. Healing after surgery often requires patience and careful activity management. By minimizing unnecessary walking and strain, accessible parking can help prevent complications and promote better outcomes. It is also helpful to plan ahead. If you know surgery is scheduled, ask your healthcare provider about eligibility for a temporary permit during preoperative appointments. Having documentation ready soon after surgery can prevent delays in obtaining the permit during the early stages of recovery. In addition to the permit, following medical guidance is crucial. Physical therapy, prescribed exercises, and adherence to weight-bearing restrictions all contribute to successful healing. Accessible parking complements these efforts by reducing avoidable physical stress. Temporary permits typically have clear expiration dates. Setting reminders to monitor expiration ensures that the permit is used appropriately. If mobility limitations continue beyond the initial timeframe, you may need updated medical certification to renew the temporary permit. For many individuals, surgery represents a turning point toward improved health. While recovery may involve temporary challenges, accommodations such as accessible parking can ease the process. By shortening distances and providing safer parking conditions, a temporary disability permit helps create a more manageable daily routine during healing. Ultimately, obtaining a temporary handicap parking permit after surgery is about supporting safe recovery. Through proper medical certification, timely application, and responsible use, individuals can benefit from improved accessibility while they regain strength and mobility. Accessible parking becomes one small but meaningful step toward returning to independence and resuming everyday activities with confidence. We hope this video helped answer your questions. If you need a handicapped placard or plate and want to avoid the confusion and long wait times, visit handicappedparking.com. Our licensed doctors are available online to help you from the comfort of your home, making the process simple and stress-free. Subscribe for more helpful information on disabled parking permits and leave a comment if you have any questions. Thanks for watching, and we'll see you in the next video.